and you meet a lot of people, you know. I mean, it's just social.
The fact is, we're living longer. In the future, older people will be healthier, more active, more independent, able to live a full life for much longer. Because of this, we are reshaping care for older people. In deciding how to reshape care for older people, we started by asking older people what they wanted and how they could be supported to lead a fulfilled life.
Compassionate care and understanding.
There needs to be better coordination between the GPs, the caring services, the home helps, the charities and the churches.
The staff should be listening.
But nobody has time to have a cup of tea and a chat.
To be able to access information about help.
These conversations led to a set of core values which describe how older people in our society should be cared for and supported. They include protect the well-being of older people, support them to lead full and active lives, do things with older people and not to them, support older people to stay safely in their homes and communities. In another of our conversations with older people, Shahida Zafar made an important point.
The way the budget is at the moment, it puts people in little boxes. For health service, they need to go to a particular department for a particular service, and then for social services, they need to go somewhere else. And sometimes it just doesn't neatly fit into any box.
To reshape care for older people well, to truly value our older people, means that all the agencies and organisations need to work together. A partnership approach is needed between health, social work, the voluntary sector and the private or independent sector. In Glasgow, the programme is supported by all four sectors through NHS Greater Glasgow and Clyde, Glasgow City Council, Glasgow Council for the Voluntary Sector and ScottishCare.
Yes, I think that looking back over the years, we've not been particularly good at responding to people's needs. We've not really worked together across health and social care and housing and voluntary agencies in a sort of integrated and coordinated way, and probably not really utilised the resources fully at our disposal.
What older people continually tell us when we talk to them about this is that actually they would prefer that we provide between us supports that would allow them to continue to live in their own homes for longer. And so what we need to do is we need to look at how can we shift some of the resource that's currently spent in residential care and nursing care and hospitals, and put, not all of it, because we still will need those things going forward, but put some of that money and that resource into supporting people to stay in their own homes, in their own communities.
The older people strategy and plan we're looking at is really important, both for older people today and thinking about the services and support needed over the next few years, and for those of us looking ahead and thinking about what we would like our old age to be. We know we're living in challenging financial times and that there will be less money available for health in the years ahead, so the money we do have really needs to be used wisely.
At this current point in time, at least 40% of our older people in Scotland will have their service delivered by an independent sector organisation. So that's hugely important for outcomes for those older people, and hugely important for the independent sector to be seen as a partner in delivering those integrated and joined up services.
Let's take a look at some examples of how this approach is already working.
You'd love to go back to your own home, yes.
But he's thinking it out.
You don't think it's possible?
Well, Marylee Lodges currently has 3 assessment at home beds, and we are jointly working with the rehabilitation team, the district nurses and the community psychiatric nurses in providing a service to patients who would normally be in hospital, however have been discharged and deemed medically fit, come to Marylee for a 3-week assessment period.
And we've been doing all your exercises with your legs, and you've been walking around a lot more. How do you feel that's...
And it's person-centred to their needs, so if it's the rehabilitation team to do with their mobility or building in their strengths, then they'll set the goals and we'll assist
We work with a number of GP practices, and the health and social care staff have patients referred to them by the GPs who may have a concern that the patient is struggling to manage their health condition or has perhaps had unplanned admissions to hospital. So the team then assess the patient, then work with the patient to make an anticipatory care plan, which looks at how the patient will react if their condition deteriorates or gets worse.
But the way I think it's going to change is that actually people will be coming in for shorter stays, and we're going to have to change the culture from creating a home for somebody where we're creating just a short-term, a holiday would be the wrong words, but a short-term stay, break, where actually it's part of their journey on the way to the place they've always called home.
Reshaping care for older people is a 10-year vision, but you can see that the practical benefits have already begun to flow. So where do the partners see it in 10 years' time?
Often it's small-scale local activities that are most effective at keeping older people well, the things that address social isolation in particular, and these are frequently delivered by volunteers.
So we've got to get this right. So I think we will continue to work together, continue to learn, so that we can actually deliver better services and better outcomes for people.
We've almost taken away people's independence by doing things for them. We need to be far better at doing things with people, encouraging people to regain their independence.
We should be able to share our different understandings of that individual and try and express to colleagues within health, to colleagues within the private sector and the voluntary sector, what it is that we understand the individual to be needing, to be feeling, to be experiencing, and hopefully that level of sharing of information, sharing of views, of culture, if you like, should rub off in terms of a much more individualised, personalised kind of approach to each and every person who comes through the system.
The Glasgow City Partnership is currently consulting with you, the public, on its draft Joint Strategic Commissioning Plan for reshaping care for older people. This is the first time as a partnership that we have set out our plans for improving older people's services in the city. This is challenging, but also a great opportunity. We are confident from what we've been told that this is what people in Glasgow would like to see, and now we are keen to hear what you have to say about our proposals. The full plan is available online at www.nhsggc.org.uk/older people, or you can phone 0800 027 7246 to request a copy or to ask for the information in another language. This consultation was launched on 15th of April 2013. The date for final submissions is Friday 28th of June 2013. You can give us your comments on the website at www.nhsggc.org.uk/older people, by email to olderpeople@nhsggc.org.uk, or by writing to Duncan Goldie, Glasgow City CHP, room 1 to 29, William Street Clinic, 120 to 140 William Street, Glasgow G3 8UR. Or you can telephone 0141 314 6237.